Hello, everybody. It's great to be here. Actually, it's great to be back. Fun fact about me, I actually lived in Helsinki, Finland for 3 years, from 2000 to 2003. And for a good part of that time, I worked for a company called CRF Box. And I eventually got transferred to the US office, and then I never really came back except for business meetings. So today I'm going to give you an in-the-trenches look at what it's like to work at solving problems around patient engagement. And so what I really want to spend time on is setting up what is patient engagement, first of all, and then look at some best practices for those of us in the trenches. We've been hearing from a lot of big global companies, and now you're going to hear from me. So, just back to my background about how I got into digital health in the first place. Let's take a step back to what I was doing at CRF Health in about 2002. So CRF Box, as it was called when it was founded here in Helsinki, Finland in about 1999, was based on the premise of capturing patient-reported outcomes data for transmission to pharmaceutical clinical trial databases. And their objective was really just to collect clean data. And this is an early representation of their product, and looks pretty clunky. Some of you may remember what a Palm Pilot was. Some of you are far too young to even know what that weird-looking thing looks like. But I dealt with this on a day-to-day basis. And what I learned through many years of implementing these systems was that the patients and providers really benefit from the self-reporting of this information. So providers, the clinicians, nurses, doctors, they felt like they were getting more information, better information about their patients' progress. And the patients, even despite these sort of clunky interfaces, even elderly, very ill patients would tell us that, this really made me feel cool. I felt like I had something to whine to every night instead of to complain to my husband or wife. And so over the years, I started thinking about, well, maybe there's another opportunity for taking a similar concept and taking it out of the clinical research context and into helping regular clinicians and regular patients who weren't involved in clinical trials, sort out their problems and coordinate care that way. So today, I'm down in the trenches in my startup, Klio Health, and Matthew told you basically what we're working on. And today, I want to share what my peers and I have come up against and what I've learned from my peers, but also through my own experiences in building that. So first of all, what is patient engagement? It's an oft-used term. In fact, I don't know if it's new here, but in the US, in North America, it is one of the most overused, almost meaningless terms used in the healthcare industry today. There's a lot of BS around it, so I think just to set us on a good path forward, let's define what I mean by engagement here. And I just went online and looked at my online dictionary, and I think this definition here is really simple. The words about participation, involvement, sharing, that's really what we're talking about when we're getting patients involved and to participate in their health care. But of course, engagement is a two-way street, and I think the industry still has a long way to go, as illustrated in these two little cartoons. On the one hand, you have a patient that is really wanting more attention from the provider, and the provider's not really listening. On the other hand, you've got a patient who is bringing in way too much information that the provider doesn't want. I think some of the previous speakers to me raised this problem. Niklas, in asking about sensors, is it a threat or an opportunity? And I'll say that many providers, many clinicians feel that this barrage of data is a threat because they don't know what to do with it. It's not really in context of what's meaningful in how they're going to treat that patient. But nevertheless, patient engagement is really important. And I just want to share with you the results of a study that was run a few years ago. But I'm not going to tell you what the intervention was. And that's really going to underscore, how we're going to continue on today. So there's a study run with 12,000 patients, and the results were that following this intervention, 96 of the patients were screened for cholesterol, over 77% of patients met cholesterol goals, and there was a 76% reduction in mortality. You don't need to be a clinician to know that those are really amazing results. So what was it? It wasn't a wonder drug. Actually, quite simply, it was a collaborative care program that was rolled out at Kaiser Permanente of Colorado. And through that program, it was not just about IT and tools implementation, it was about a whole process change involving how the providers, the clinicians, all interacted and collaborated and cooperated with patients, using technology to get information from the patient and communicate with each other. So that's why patient engagement is really important. This is a shining example of something that was probably quite expensive to roll out. 12,000 patients, so it scaled quite well, but I'm sure that Kaiser Permanente invested a lot of money into it, which a lot of organizations are not prepared to do today. But still, there's certainly a long way to go for the rest of the world to catch up to this, and by that I actually mean the rest of the North American healthcare system. Most don't operate like Kaiser Permanente, but the data shows us that people are really interested and willing to engage in their health. So there's a lot of positive indicators, even though we still have a long way to go. So that's really the big opportunity that we're facing. Okay, so now what? How many of you here are entrepreneurs? Okay, and then how many of you here are clinicians or work for a healthcare system? Okay, so we have more entrepreneurs here. Okay, great. So you're an entrepreneur, and you're trying to solve problems in patient engagement. What things should you be thinking about? So I'm going to take you through a few examples and best practices in these three categories. So first is provider involvement. I've seen a lot of my peers stumble and have problems, and including my own company. But some of the issues we're going to talk about are about matching expectations, making sure there's something in it for the provider, and also addressing some basic logistical issues like onboarding. How does the patient actually get the app, or whatever it is? Patient incentives. So how do you get the patient to engage in the long term? And then finally, reducing barriers. So we're in the startup world. It's easy to get enchanted by the promise of an optimistic and bright future, but we're here in Finland, so I think there's a dose of realism here as well. But there's the hard, cold reality of healthcare. These are big organizations, typically slow to change, with really tricky clinical workflows, systems that aren't interoperable, and also user considerations. So for those of you who are entrepreneurs, it might be tough when you look over at your neighbor in your startup accelerator and see he's or she is building some app to order beer on demand and doesn't have to worry about real, serious regulatory issues or data privacy. So we'll talk about that a little bit. So first, how do we make this work for providers? So you've probably seen these screenshots before, Apple Health Kit. So the reaction when Apple Health Kit first got announced was from providers. Oh no, more data. What are we going to do with this? It doesn't make sense. And really, I think for thinking about the provider and putting yourself in the clinician's shoes, we have to think about what's the important information that's going to be actionable for the clinician. For me, as an entrepreneur and somebody who's relatively young and relatively healthy, calories burned doesn't really matter. Maybe the one thing that my doctor really does want to know is how much I'm sleeping and what my stress levels are, and maybe my blood pressure. That's what's important. So that means that there needs to be some way to filter that information out. And then for the clinician, then what's in it for him or her? There's no way we can get a clinician to be excited and to promote a new tool to a patient population if they're not getting anything out of it themselves. So we need to get low-hanging fruit. How do we show the clinician and give feedback and show that the system's working, that patient data is coming in, for example, and that they can do something with it? So when we worked with clinicians, they told us that we really want to see how our patients are doing. We want to view data in ways that we've never been able to use it before, and we want to play around with the data a little bit. And then, onboarding. This screenshot is from a patient portal that's part of the Epic EMR system. But one of the biggest problems in any kind of healthcare tool implementation is how's the patient going to get signed up? Where are they going to get signed up? If the clinician is telling them about it, are they letting the patient just go home and telling them to go to some website or the app store to download it? So from our learnings and talking to all my peers, it's really, if the patient has to be onboarded at the clinic, don't let the patient go home without making sure they're signed up and they know what to do. In this case, it's a very complicated process. You have to get some special code, type it in, and I lost my code after 2 hours. I don't know. I put it in some pocket and it disappeared forever. And so it was another 6 months before I got on. So that's the providers. Now how about patients? How do we incentivize the patients? We're going to have better luck incentivizing the patients. Mostly, patients are going to be enthusiastic about something new, even if they are, maybe not as tech savvy as you think they are. There's usually some positivism there. But first of all, I think with incentivizing patients, it's about making sure that they get better healthcare. So that really, for me, I think is what patients should be. That should be the driver for patients to get involved and use a new tool. So first of all, it's give them useful information. Even if the ultimate goal is to give them better healthcare and give them better healthcare service and make them feel like they're really participating, sometimes you need to have a few nudges to get them to engage long enough so that they'll be able to stay on for longer, so enhancing stickiness. So this is an example from Propeller Health, and they do a really nice job of using the patient-generated health data to feed back information to the patient that's useful. It's using that information, using location information to give useful coaching comments that the patient can use. Now, one comment here, though, is that you can see the font is really, really small. Clearly, their demographic is probably somebody younger, maybe a child, because it's actually quite hard to read. But there's a lot of really useful information here if somebody's dealing with asthma. Patients like me has been mentioned before by Niklas, I think. But find me some friends. So patients love knowing that they're not alone. And patients like me is a testament to this. They have thousands of patients on their network that share an enormous amount of information about their personal lives, but also about their healthcare. And a lot of it is not necessarily identity blinded. They share all of it out in the open. It's amazing. And so how can you bring community into your tool to keep people coming back because they're searching for relationships? And then what about other motivators like gamification? This is an example from Fitbit. They use a few techniques. One is just to give you the numbers so you can see how many steps you walked. But then they have this really cute but subtle smiley face. The smile gets bigger as you walk further, and so your goal is to get to the big happy face where I think it eventually sticks its tongue out at you, I think. It's really cute, and so those are some really nice touches. It doesn't have to be over the head badges and songs all the time. Or there's also just clean, hard, cold cash or rewards. And so Mango Health, which is a California-based company creating adherence tools, has a point system where you can trade in your points to buy stuff with some of their affiliate partners. Okay, so it looks like time to start wrapping up, I guess. But the last thing I want to talk about is reducing barriers, some of those ugly realities that we definitely have to face in healthcare and can't be ignored. I go to a lot of healthcare conferences, and sometimes these things tend to get glossed over. So just a grim dose of reality here. This is what healthcare professionals, at least in the US, this is what they're logging into just about every day. This is a screenshot from Epic. And so this is their reality. It looks like 1995, and in fact, they are running Windows 95. And I kid you not, when I go into providers' offices, they are running Windows 95 with Internet Explorer 6. So that is the cold, hard reality. But added to this is a complexity that these EMR systems are very much part of the central workflow. So if you have a tool that requires a provider to log in, try to see if there are other ways to have single sign-on with the EMR provider, integrate with the EMR provider so that you can have a tab, make sure the messaging flows in and there's synchronization. All easier said than done, but ignoring it will also get you nowhere, as I have discovered, in fact. But there's there's a lot of things here that are sort of complicated about the workflows. Onboarding I addressed earlier. But there are some healthcare systems that are also waking up to the fact that they need to change. And here's a photograph from Atlantic Health System's sort of Health Connect centers. And they've modeled this after the Genius Bar at Apple retail stores, where they have in their hospitals a little sort of Genius Bar where people can go and inquire about different tools, can learn about them and get help in setting them up. So it's really amazing. They have a long way to go, but this is a very, very positive start and probably a good example of how patients can get onboarded. And then finally, what about usability issues? So I don't know how many of you watch this show, but this is the cast of Silicon Valley. And so one of the biggest criticisms of the whole digital health industry, and Matthew's laughing here, is because most of the people, as it turns out, developing digital health solutions most of the time look like this. They're young, white, male, you get the idea. But the people using the solutions look more like the cast of, what is this, the Exotic Marigold Hotel, so Judi Dench and family. So what do you do? I'm not so young, in fact, but we still run into issues, and our designer ran into a really interesting problem where we ran some usability tests, and this is the home page. Our plus 65 population just stopped dead when we asked them to go beyond the home page. They didn't know where to find the menu. So that hamburger bar that most of us who use digital or use mobile devices know, those three horizontal lines, that's where you go. That's where you get the menu. So we had to change things. We had to actually write menu. And I think we're starting to see more digital health solutions actually employ this, put menu somewhere. The small things can matter. But some other companies will really take the audience to heart and build the entire product from the ground up, bearing into consideration the ergonomic issues faced by an aging population. So depending on who your audience is, depending how your product is going to be used, can emphasize the fact of making sure you get out in the field and know who your audience. It's really easy to get insular and then just internally test things among your 20 or maybe even 30 or even 40-something peers, but that's not really who we're serving. So just to wrap up and summarize, we talked about making sure that providers are involved, matching expectations to what data they need, and so on, making sure that there's smooth onboarding processes. How can we incent patients through rewards and giving feedback to them? And finally, what are the cold, hard realities that we have to address and keep our eyes open to? So there's a long way to go, but this is really just the beginning. It's a very exciting time in digital health, and there's a lot to be done in patient engagement. I really truly feel that this is where a lot of difference is going to be made. And not too long from now, I hope that healthcare really looks like this, where patients will be able to self-manage from home, and they'll get the support from clinicians when and whenever they need. Thanks.